The emergency room at the Princess Margaret Hospital has been overcrowded with persons seeking medical care over the past few months. However, yesterday the uptick was so significant that health officials had to open other wards to get additional beds.
We've actually looked at the data, and the data has shown us that from November we've been seeing this uptick. However, we've seen a slight increase after the holidays as well. And it's, those patients with what we call have the chronic non-communicable diseases like hypertension, diabetes, heart disease. And so they're now coming through the emergency room to be seen. And so the emergency room is actually really bursting at the seams.
According to Director of the Public Hospitals Authority, Dr. Abinette Roll, the average amount of persons seeking to enter the emergency room have doubled and even tripled in recent days.
What used to be an emergency room that would have about 18 to 22 patients waiting for admission has now been increased to the numbers were up to 47 on yesterday. And in the report this morning, there were up to 60-something patients. So really trying to get the patients out of the facility.
And while PMH and Doctors Hospital have an agreement to take on some of PMH's patients, Dr. Roll says they can only move patients who are stable.
Doctors Hospital, where we are taking patients out, but the more stable patients. What's happening right now is a lot of the patients that we're seeing now are not the stable patients. And so we still have the ability now to care for them before we send them on to Doctors Hospital, but there is an actual uptick of these cases.
Dr. Roll revealed as of today they still have an issue with boarders or patients whose family refuse to retrieve them. These boarders take up about 20 beds at PMH, which is an entire ward. Meantime, Minister of Health and Wellness Dr. Michael Darville is asking the public to be patient as renovations at the Princess Margaret Hospital remain ongoing.
Yesterday we had a backlog. The situation is presently under control. As you are aware, we're doing massive renovations at Princess Margaret Hospital, female surgical 1, male medical 2, the basement of the legacy unit, and the list goes on and on. This has created some additional shortage of bed space. We went into the contractual agreement with Doctors Hospital. There's a bottleneck. That has been worked out. And so from time to time, when the admissions rate and the accident emergency goes up, we will have challenges. But we assure the Bahamian people that the contractual agreement that we went into for repairs is somewhere between 14 to 18 months, and we ask the general population to please bear with us. At the end of the day, we're going to renovate these wards, we're going to bring more beds on stream, and we're going to improve the working conditions for the patients as well as our physicians and nurses.
Tyler Simonet, Eyewitness News.